Number 1. Rabies. Rabies usually begins with a simple event, a bite or scratch from an infected animal. The wound may look small and the person may feel completely normal, but the virus has already entered the body. Rabies often moves from the wound into nearby nerves. It then travels toward the spinal cord and brain. This process can take weeks or months. That delay creates a short but critical chance to stop it. Before symptoms begin, doctors can clean the wound, give a rabies vaccine, and provide rabies immune globulin when needed. This post-exposure treatment is highly effective. The situation changes after the virus reaches the brain. It causes severe inflammation called encephalitis. Early symptoms may look ordinary, such as fever, weakness, or headache. Later, the patient may develop confusion, paralysis, hallucinations, trouble swallowing, and painful throat spasms. Water can trigger those spasms, which creates the famous fear of water. At this stage, rabies is nearly always fatal. Treatment is usually supportive because the virus is already deep inside the nervous system. The immune system also reacts too late. That is why a possible rabies exposure is an emergency, even when the bite seems harmless. Number 2. Cancer. Cancer is a large group of diseases, not one single illness. Some cancers can be cured, especially when doctors find them early. The hardest situation is often advanced or metastatic cancer, when cancer cells have spread beyond the original organ. Cancer starts when body cells gain changes that let them grow without normal control. Because these cells came from the patient's own body, treatment must destroy them without causing too much damage to healthy tissue. That balance is difficult. Cancer cells also keep changing. A tumor may contain several groups of cells with different mutations. One group may die during chemotherapy while another survives. The resistant cells then multiply and the tumor returns. Some cells can leave the original tumor, travel through blood or lymph, and create new tumors in the liver, lungs, bones, brain, or other organs. Surgery can remove visible tumors. Radiation can destroy selected areas. Chemotherapy, targeted drugs, hormone therapy, and immunotherapy can shrink or control many cancers. But metastatic disease may exist in many places at once, including tiny areas that scans cannot detect. This is why there is no single cure for cancer. The target changes between cancer types, between patients, and even inside the same tumor. Number 3. HIV. HIV is a virus that attacks the immune system. Without treatment, it can slowly destroy CD4 cells, which help organize the body's defense against infections. Today, however, HIV can often be controlled for decades. Antiretroviral therapy blocks several steps that HIV needs to make new copies. When treatment works, the amount of virus in the blood can fall to an undetectable level. A person who keeps an undetectable viral load does not transmit HIV through sex. This is known as U equals U. Undetectable equals untransmittable. But undetectable does not mean the virus has left the body. HIV can insert its genetic instructions into the DNA of infected cells. Some of those cells become inactive and form a latent reservoir. The virus is silent there. It is not producing enough new material for the immune system or medicine to easily find. If treatment stops, some hidden cells can become active again. The virus returns to the blood and starts multiplying. A few people have reached long-term remission after rare stem cell transplants, but those procedures were used for serious cancers and carry major risks. For most patients, daily medicine turns HIV into a manageable chronic condition. It controls the virus extremely well, but it does not remove every infected cell. Number 4. Alzheimer's disease. Alzheimer's disease usually appears as growing memory problems, but it is more than normal aging. It is a progressive brain disease that slowly affects memory, language, judgment, personality, and the ability to perform daily tasks. The damage begins long before the symptoms become obvious. Beta amyloid protein can build up between brain cells. Abnormal tau protein can collect inside them. Communication between neurons starts to fail. Later, neurons die and parts of the brain shrink. This long silent period creates a major problem. By the time a family notices repeated questions, confusion, or getting lost in familiar places, important brain connections may already be damaged. The body cannot easily replace those lost neurons. Some medicines can temporarily help memory or behavior. Newer drugs, including lecanemab and donanemab, target amyloid in people with early Alzheimer's. They can modestly slow cognitive and functional decline in selected patients. They do not stop the disease completely. They also do not restore memories that have already been lost. Alzheimer's is not caused by one simple switch. Age, genes, blood vessel health, inflammation, and other brain changes may all contribute. Medicine can now slow part of the process for some people. It still cannot rebuild every damaged connection or return the brain to its earlier condition. Number 5. Type 1. Diabetes. Type 1 diabetes can begin in childhood, the teenage years, or adulthood. A person may become very thirsty, lose weight, urinate often, and feel exhausted. The problem is not eating too much sugar. It is an immune attack inside the pancreas. The immune system destroys beta cells, which normally produce insulin. Insulin works like a key. It helps glucose leave the blood and enter cells for energy. Without enough insulin, glucose builds up in the bloodstream, while the body's cells cannot use it properly. The body may begin breaking down fat for fuel. This produces ketones. If ketones hormones rise too high, they can cause diabetic ketoacidosis, a life-threatening emergency. Daily insulin replaces the missing hormone. Pumps can deliver small doses throughout the day. Continuous glucose monitors show whether blood sugar is rising or falling. Automated systems can connect both devices and adjust insulin more accurately. But insulin is management, not a cure. It does not stop the autoimmune attack or regrow the original beta cells. Pancreas or islet cell transplants can restore insulin production in selected patients, but they require immune-suppressing drugs and are not routine cures. Researchers are testing replacement cells, immune treatments, and artificial pancreas technology. For now, treatment replaces the lost function. The original immune mistake remains. Number 6. Herpes. Herpes is common, and many infected people have mild symptoms or no clear symptoms at all. Herpes simplex virus type 1 often causes oral cold sores. Type 2 more often causes genital herpes, although either type can infect either location. The first infection begins in skin or mucous tissue. Then the virus enters nearby sensory nerves and travels to a cluster of nerve cells. There it becomes latent. This means it stays inside the body in an inactive state. The immune system can control the infection, and visible sores can heal, but the viral DNA remains inside nerve cells. Later, the virus may reactivate and travel back to the skin. This can cause another outbreak or silent shedding, when transmission is possible without obvious sores. Antiviral drugs such as acyclovir, valacyclovir, and famciclovir can shorten outbreaks. Daily suppressive treatment can reduce how often outbreaks happen and lower transmission risk. These drugs work best when the virus is actively copying itself. They cannot remove the latent virus. During latency, there is very little active virus for medicine to attack. Destroying infected nerve cells would also create serious damage because neurons are difficult to replace. The outbreak can disappear completely. The hidden infection stays inside the nervous system and may become active again later. Number 7. Parkinson's disease. Parkinson's disease often becomes visible through shaking, slow movement, stiffness, or balance problems. But the disease begins inside the brain, where important movement control cells gradually stop working and die. Many of these neurons are located in a region called the substantia nigra. They produce dopamine, a chemical messenger used by brain circuits that plan and control movement. As dopamine falls, movements become harder to start and less smooth. Levodopa is converted into dopamine in the brain. It can greatly improve movement, especially during the earlier years of treatment. Other medicines can copy dopamine's effects or help it remain active longer. Deep brain stimulation uses implanted electrodes to change abnormal activity in movement circuits. These treatments can reduce symptoms, but they do not replace all the neurons already lost. They also do not reliably stop the disease from progressing. Over time, the effect of medication may become less predictable. Parkinson's is not only a movement disorder, it can also affect sleep, mood, digestion, thinking, blood pressure, and the sense of smell. Most cases do not have one clear cause. Aging, genes, environmental exposure, inflammation, and abnormal alpha-synuclein protein may all play a role. Medicine can improve the signal. It cannot yet stop the cells producing that signal from disappearing. Number 8. Lupus. Lupus is a chronic autoimmune disease. It can look very different from one patient to another. One person may mainly have joint pain and skin rashes. Another may develop serious inflammation in the kidneys, lungs, heart, blood, or brain. The problem begins with the immune system. Its normal job is to recognize infections and damaged cells. In lupus, immune cells and antibodies can attack healthy tissue. This creates inflammation in several parts of the body. Lupus often moves between two situations. During a flare, symptoms and inflammation become more active. During remission, the disease becomes quieter. A person may feel better for months and then suddenly become sick again. Treatment depends on which organs are affected. Anti-inflammatory medicines can reduce pain. Hydroxychloroquine can lower flares for many patients. Steroids, immune-suppressing drugs, and targeted biologic medicines can control stronger attacks and protect organs. But doctors cannot simply switch off the immune system forever. The patient still needs it to fight bacteria, viruses, and other threats. Strong immune suppression can increase infection risk and cause other side effects. Lupus also has no single known cause. Genes, hormones, immune signals, and environmental triggers may combine differently in each person. Treatment can control the attack. It cannot yet permanently reset the immune system. Number 9. Multiple sclerosis. Multiple sclerosis, or MS, is a disease of the brain and spinal cord. It often begins in young or middle adulthood. The first sign may be blurred vision, numbness, weakness, poor balance, or an electric shock feeling during neck movement. In MS, the immune system attacks myelin. Myelin is the protective layer around nerve fibers. It works like insulation around an electrical wire and helps nerve signals travel quickly and accurately. When myelin is damaged, messages can slow down, become distorted, or stop. The exact symptoms depend on where the the damage occurs. Injury near the optic nerve may affect vision. Damage in another area may affect walking, sensation, bladder control, or coordination. Disease-modifying treatments can reduce relapses and lower the number of new damaged areas. Steroids can shorten some attacks. Physical and occupational therapy can help patients keep daily function. The problem is repair. Some myelin can grow back, especially early in the disease. Repeated inflammation may also damage the nerve fiber underneath. Lost neurons and long nerve pathways are much harder to rebuild. MS has different patterns. Some people have attacks followed by recovery. Others slowly worsen over time. Treatment can limit new immune attacks and slow progression. It cannot yet erase every scar or fully restore every damaged pathway in the central nervous system. Number 10. ALS. ALS is a progressive disease that attacks the nerve cells controlling voluntary movement. It may begin with a weak hand, frequent tripping, muscle cramps, or speech that becomes difficult to understand. The person is not simply losing muscle strength. The communication system between the nervous system and muscles is breaking down. ALS destroys motor neurons in the brain and spinal cord. These cells carry commands to muscles used for walking, speaking, swallowing, and breathing. When motor neurons die, the muscles receive fewer signals. They weaken, shrink, and eventually stop working. Sensation is often less affected because ALS mainly targets the movement system. However, thinking, language, or behavior can also change in some patients. The disease is not identical in every person. Riluzole, edaravone, and certain gene-specific treatments may slow progression or extend survival for some patients. Breathing support, feeding support, communication devices, therapy, and coordinated care can improve comfort and daily life. But no current treatment can replace all dead motor neurons or rebuild the long connections to muscles. ALS is also biologically complex. Some cases are inherited, while most have no single known cause. Abnormal proteins, inflammation, damaged RNA handling, and cell energy problems may be involved. Medicine can support the remaining system. It cannot yet reverse the loss of motor neurons.